Hello and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at Celiac.com. And now, let's move on to more Celiac.com news. This research update comes to us from a recent study published in Curious, part of Springer Nature. Nutritional Deficiencies and Challenges of a Gluten-Free Diet for Celiac Disease. Patient's celiac disease is a complex autoimmune disorder that requires strict, lifelong adherence to a gluten-free diet for effective management. This diet, while essential for recovery and symptom relief, poses several nutritional and psychological challenges. A deeper understanding of these challenges helps highlight the need for a comprehensive approach to supporting individuals with celiac disease. The importance of a gluten-free diet. The gluten-free diet is the cornerstone of treatment for individuals with celiac disease. When people with celiac disease consume gluten, their immune system attacks the lining of the small intestine, causing damage to the villi, which are essential for nutrient absorption. Over time, this leads to significant health problems, including malabsorption of nutrients such as calcium, vitamin D, iron, and folic acid. Left untreated, this can result in conditions such as osteoporosis, anemia, and neurological issues. Adopting a gluten-free diet is highly effective in reducing symptoms, healing the intestinal lining, and preventing long-term complications. Many patients report significant improvements in gastrointestinal symptoms such as diarrhea, abdominal pain, and bloating after transitioning to the diet. However, even strict adherence to the diet does not guarantee complete recovery for all individuals, with older adults often experiencing slower or incomplete healing. Nutritional deficiencies in a gluten-free diet. Although the gluten-free diet resolves many symptoms of celiac disease, it is associated with a range of nutritional deficiencies due to the exclusion of common grains like wheat, barley, and rye. Macronutrient imbalances. Fats. Gluten-free processed foods are often higher in total fats and saturated fats than their gluten-containing counterparts. This imbalance increases the risk of cardiovascular disease and metabolic disorders in celiac patients. Carbohydrates. Many gluten-free products rely on high glycemic index ingredients, leading to an overconsumption of simple sugars and a reduction in complex carbohydrates. This dietary pattern is linked to insulin resistance and an increased risk of diabetes. Fiber. Low fiber intake is a common issue among those on a gluten-free diet, as many gluten-free products lack whole grains. Insufficient fiber can lead to gastrointestinal discomfort, constipation, and long-term digestive issues. Proteins. While most individuals on a gluten-free diet consume adequate protein, the primary sources are often animal-based, which may not provide the balance of nutrients found in plant-based alternatives. Micronutrient deficiencies. Iron. Iron deficiency is prevalent in untreated and newly diagnosed celiac patients. Although levels improve with intestinal healing, iron-rich foods or supplements are often necessary to prevent anemia, especially in women. Calcium and vitamin D. These nutrients are critical for bone health, but are often deficient in individuals with celiac disease. Supplementation and dietary planning are essential to prevent osteoporosis. B vitamins. Low levels of folate and vitamin B12 are common and can contribute to elevated homocysteine levels, which increase the risk of cardiovascular complications. Supplementation can help address these deficiencies. Other minerals, zinc, magnesium, and selenium deficiencies are frequently observed. Gluten-free processed foods often lack these essential minerals, making supplementation or diet adjustments necessary. Psychological and social challenges. Maintaining a gluten-free diet significantly impacts social and psychological well-being. The need for strict dietary adherence can lead to feelings of isolation, anxiety, and depression. Individuals often experience difficulties dining out or participating in social gatherings due to concerns about cross-contamination or the unavailability of gluten-free options. This can result in avoidance of social activities and a sense of exclusion. In some cases, these challenges affect adherence to the diet, as individuals may intentionally consume gluten-containing foods to feel socially included. However, this behavior risks worsening symptoms and increasing the likelihood of severe complications. Support systems, education, and counseling can play a crucial role in helping individuals navigate these challenges and maintain their quality of life. The role of monitoring and supplements. Managing celiac disease goes beyond eliminating gluten from the diet. Regular monitoring of nutritional status is vital to identify and address deficiencies early. Blood tests can help track levels of critical nutrients such as iron, calcium, vitamin D, and folate, enabling timely interventions. Nutritional counseling and education are essential components of care for celiac patients. Healthcare providers can guide patients in incorporating naturally gluten-free, nutrient-rich foods like fruits, vegetables, lean proteins, and pseudo-cereals such as quinoa and amaranth. Supplements may also be recommended, particularly during the initial years of dietary transition, to ensure adequate intake of critical nutrients. Why this study matters for celiac disease patients. This research underscores the multifaceted challenges faced by individuals with celiac disease in managing their condition. While the gluten-free diet is an effective treatment, it is not without its limitations. Nutritional deficiencies and psychological struggles are common, highlighting the need for a more comprehensive approach to care. For individuals with celiac disease, this study emphasizes the importance of regular nutritional assessments, balanced meal planning, and support systems to maintain both physical and mental health. By addressing these challenges, healthcare providers and patients can work together to improve quality of life and long-term outcomes for those living with this condition. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.